Okay, so moving on to the next question. Agra, 35 male. My wife has struggled with migraines for years, and while I do my best to be supportive, there are times I feel completely helpless seeing her in so much pain. I want to do more, but I'm unsure how to be truly helpful without overstepping. What can I do? How can I help to be more proactive in supporting her during her worst migraine days while still respecting her space and needs?
So it's again very like very common day to day issue because headache is migraine is more common in reproductive age group. He's a young, I think 34, 35. His wife
Yeah.
must be in the reproductive age group. They have to plan family and all, and at the same time they have to take medication, and there may be so many queries in their brain whether we should take medication or not, whether if my wife would conceive during the like while she was taking medication, so how these medication will affect the baby and all. So there are so many questions in this query actually.
Yeah.
So again, there are different pharmaceutical agent we use in reproductive age group, especially those who are willing to have a baby or those who are planning a family. So we give medication which is safe in pregnancy also, or which will not suffer in having conceived, or which will not suffer during pregnancy, which don't have any side effect with the baby. And the rest treatment in this reproductive age group, we have to just take care of these points especially.
Can arousal increase somebody having a migraine, or can it spawn a migraine?
It is a different headache. Actually, there are so many other kind of headache which
There is some.
occurs exercise, like exertion induced headache, which occurs during reproduction, like mating. There are so many other kind of headache. Usually, migraine does not precipitate with the sexual activity.
Okay. Yeah. So the next question is from Mysore, 24-year-old female. I've recently started experiencing migraines and I'm still evaluating different treatment options. I am hearing conflicting advice. Some suggest Ayurveda, others say to see a neurologist, and family members recommend yoga and diet changes. How do I decide the best course of treatment when there's so much conflicting advice around me?
Listen, family advice is correct actually. So yoga routine, daily lifestyle modification is definitely important. Anyway, any doctor will suggest that also. And
Yeah.
and for migraine or for any headache, it's better to consult a neurologist rather than consulting any other physician or any other
Alternative.
alternative medicine like homeo, Ayurvedic, or
Yeah.
although they might work. As I can't say because I am not in that field. They might
Mhm.
work.
Is it right to uh, is it all right to say that if somebody is getting headaches, the first doctor they should go for is a neurologist for headaches?
Yes,
Because it's
if there is
pretty
availability
decide
of
how
a
to
neurologist, is there, they must go to the neurologist only. If neurologist is not available nearby, like in their surroundings or in their town, then they can consult a physician also, general physician like MD medicine people.
yeah.
So they can do initial workup, they can give initial treatment, and if there is no improvement, they can refer it to a neurologist. Like practice in Western countries.
Yes.
Like first you have to consult a family physician, then only he will refer because
Yeah.
like appointment with the neurologist is quite difficult there.
Yes. And just to add to that, to our international audience, Dr. Hariom, you can always book consultation even if you are in New York or in New Jersey or New Orleans.